One.
Okay, so we took it out. I already took out one, but so when you go to take it out, you just flip it out. And you could even hold on to these if, in case, give it to the patient in case he loses it. You can remake another set with them. So then you need to cut them out. Usually a curved type scissor like this works really well. And you can cut it out. Usually I cut out in the right in the middle of the first molar. You can also cut out with the big scissors all this excess big stuff that's just going to get in your way. That way it's easier to work with. Because we're not going to use any of this big stuff. So on the lingual, you're going to just cut it straight across, just above the teeth. Nice and straight line. And you can use the curvature of the scissors. Okay, so you would cut that little tag off because that would bother the patient's tongue. But let's keep going. So on the facial, there's two train of thoughts. You can cut it either straight across like you did the lingual. It depends on the doctor how he wants it. But we're going to have you, for class purposes, have you cut it scalloped around the teeth. So you're going to cut it scalloped around the teeth. Right at the tooth or just above the tooth. You can use the curvature of the scissors to help you. So that would be on the facial or the buccal, however you want to call it. So you're going to do that all the way across. So this is, I already did the lower. So it's scalloped on the facial and just straight across on the lower. Then you want to check out these little, I just didn't finish this little part right here. Then you want to feel around. See how there's a little spot right here that's going to bug the tongue. So you want to remove any of those little tags that are going to be bothersome to the tongue. So feel around with your finger. There's a little spot right there. You don't want to hand it to a patient where it's going to be bothersome. So where else? Anywhere that's going to be really bothersome, and any pointy spots. So I still have the upper to cut, but the bottom's done. So I'm assuming I finished both upper and lower. If they both look like this, then we're ready to disinfect it for 10 minutes, rinse it, and then you put it in a baggie to get ready to give it to the patient. Okay, you'd have the patient try it on. Now once that is done, you have to go over instructions on how to use it to the patient. Now here's some opulence. It's a whitening solution. They come in different concentrations. This one's a 15%, so if your office has more than different concentrations, it would depend on what the doctor wants the patient to use. This one's at 15%. It's mint flavored. And what you do is have the patient, this one you just cut off the tip, break off the tip. And you have the patient put just a small amount where the blackout was. Not even a whole drop, just a small amount. Just a little bit of gel in every spot where you put the blackout. And then they put it on. and they wear that at night. Usually they wear it for a couple weeks. The mint doesn't taste bad. While they're doing the bleaching or the whitening trays, they need to avoid anything that will stain the teeth. Coffee, red wine, anything, blueberries, anything like that. Once they get the teeth to the color they like, they can stop wearing it, and they still have to avoid those foods and drinks for 2 weeks after, until their teeth stabilize. So that's all there is to the whitening.